Very good evening to all of you. So today we will be discussing something which a lot of people find difficult to digest, difficult to understand. And it is a scenario all of us in our clinical practice are going to face. It's not necessarily going to be for a physician, but a surgeon, an anesthesiologist, intensivist, all kinds of clinical medicine. You will face this scenario some way or the other. And if you mismanage these patients, then it can lead to a lot of problems, sometimes even mortality of the patient. Although these are things which we have been taught in MBBS in first year, second year, in physiology, pathology, we never really get the true grasp of it. So, in this session, I will try to simplify all of these topics. All right. It's a very broad concept, a very misunderstood concept, but really speaking, it's not that difficult. There are a few key things you need to know about this. So, this topic that we are going to discuss is called as shock. Shock is something we get many times in our life, but clinical shock is different. And this is the shock which can save the life of the patient if you manage properly. So, I am Dr. Amrit Nasta, and what we are going to discuss is going to be the different types of shocks. How do you assess and how do you manage the shock? Okay, so let's begin with this module and let us try to first understand the meaning of the word shock. When I say shock in clinical practice, what has really happened to the patient? So, first thing that you need to know is shock is not a disease. Okay, it is the effect of certain diseases where I enter a shocked state. All right, it is a state like how someone who has diabetes can become hyperglycemic. So, hyperglycemia is a state, or if he takes too much insulin, he can become hypoglycemic. Hypoglycemia is a state. Similarly, shock can happen in certain diseases where the body undergoes some changes. So, shock is a state, it's the effect of certain diseases. But what is this effect? If you read the books, what will the books tell you? The books will tell you it's a state of reduced tissue perfusion. All right, it's a state of reduced tissue perfusion. Now, what does that mean? Reduced tissue perfusion means my tissue or organs, basically organs, are not getting adequate perfusion, means not getting enough blood, not getting enough oxygen. And when the tissue does not get enough blood or enough oxygen, what does the tissue do? The tissue starts undergoing anaerobic metabolism. Okay, the tissue starts undergoing anaerobic metabolism. And why is this happening? It's because it is inadequate for normal cellular respiration. So there is an inadequate supply of oxygen, inadequate supply of blood. The supply is inadequate for normal circulation. And that leads to anaerobic metabolism. Now, what is the big deal if there is anaerobic metabolism? Like, when you're running and you run too much for too long, or maybe you're not trained enough, then our muscles start cramping. Why are they cramping? That's because they are not getting enough blood supply compared to your demand. And because they are becoming ischemic, they are undergoing anaerobic metabolism, same thing. And this anaerobic metabolism leads to an effect which is called as lactic acidosis. Now, it is simple to understand that more the hypoxia, lower the circulation, more the anaerobic metabolism, more will be the lactic acidosis. So, can we say that the more severe the ischemia, the more profound will be the lactic acidosis, the more profound can you say is the state of shock. So someone who is having a hyperglycemia with a sugar 300 milligram percent versus someone who's having hyperglycemia 400, 500, 600. So it is proportionately worsening. Similarly, more your lactic acids increase, more is the severity of the hypoperfusion. As simple as that. So when I say shock, it simply means, in simple words, hypoperfusion. And how do I measure this hypoperfusion? It can be measured in various ways. One of the ways is serum lactates. So when you study, a lot of scores in medicine and surgery, they use serum lactate levels. So the serum lactates will increase. It means there is ischemia or hypoperfusion, which is one of the markers of shock. So one of the ways of understanding that there is shock is I should see increased serum lactates or I should see decrease in pH. There are more markers which will go along the way, but take shock as a state, which is a clinical state, like how you can measure someone's blood sugar. You should be able to somehow measure the shock or the severity of the disease. This is the simple meaning. Now come to a little basic understanding about why does someone get shock? What are the different types of shocks? Like why should the tissue perfusion reduce? Common sense will tell you that tissue perfusion will reduce when there is hypovolemia. So obviously, hypovolemic shock is the most common type of shock. Okay, this can be asked as an MCQ also. And there are various reasons why someone will become hypovolemic. This can happen because of trauma leading to hemorrhage. So as surgeons, we face hemorrhagic shock, like a post-operative patient who got bleeding. So hemorrhagic shock, or it can be hypovolemia because of dehydration, gastroenteritis, burns, all these. So any cause of dehydration, burns, acute gastroenteritis, these kind of diseases, AGE. So there are various ways in which person can become hypovolemic. Simple, but this is not the only kind. So I don't have enough blood in my circulation, tissue will not get enough perfusion, you become hypovolemic. The other cause of shock, which is seen more in medical practice, more in ICU patients, is going to be cardiogenic shock. All right, this you will see in more. It's not so much faced in surgery, it is faced more in intensive care patients and, of course, medical patients. So, someone who got acute MI or someone who got atrial fibrillation, certain arrhythmias, cardiomyopathies, basically any cardiac illness, pericardiac tamponade. So, a lot of these diseases where the heart is not going to have enough power to pump the blood, in those cases, there will be cardiogenic shock. So, a person in acute MI can die. One of the reasons is because of cardiogenic shock. Heart has become too weak to pump. The next kind of shock, which is very interesting, is called as obstructive shock. This is very unique. This is seen in emergency. This is seen in surgery also. This is seen in medicine also. It comes in a lot of ways. Obstructive shock is when there is going to be reduced relaxation of the heart. So heart is not relaxing, or reduced venous return to the heart. Or in simple words, there should be a diastolic dysfunction. There are various ways of looking at it. When I give you the examples, you'll understand it better. Basically, the heart is not diseased. It's not that the heart does not have the power. Systole is fine, but the heart is not able to relax, or the veins are not filling the heart for some reason. The best examples of obstructive shock is going to be tension pneumothorax, cardiac tamponade, pulmonary embolism. These are the best examples. So a person dies in these diseases because of obstructive shock, like tension pneumothorax. What happens in tension pneumothorax? The collapsed lung becomes so much shifted to the other side because of the tension, and it starts compressing the SVC because of mediastinal shift. If SVC gets compressed, then the venous return to the heart will reduce, cardiac output will reduce, obstructive shock. In cardiac tamponade, there is blood around the heart. Because of the blood around the heart cannot relax. Because the heart cannot relax, it cannot get filled. If it doesn't get filled, what will it throw? Right? That is obstructive shock. And the fourth kind of shock, which is seen a lot in surgical practice, is called as distributive shock. This I will discuss a little bit in detail. Distributive shock. Best example is septic shock. But then there are other types like anaphylaxis, which is also a type of distributive shock, anaphylactic shock, and a unique kind of shock called as neurogenic shock. It is a bit like distributive shock only, that's why I'm putting it over here. So, grossly speaking, if a person is in a shock state, One of these could be the reasons, or there can be a combined or a combination of reasons which will lead to reduced tissue perfusion. Right, this is the main thing you need to understand. There should be a reduced tissue perfusion. Now let's try to understand what does this reduced tissue perfusion lead to, and what exactly happens, and why does the patient die. Basically, we need to understand two kinds of shocks. One is this, the first three categories, they are all very similar, where there is not enough blood going to the peripheral circulation for any of these reasons. Either there is not enough blood in circulation, or heart is not pumping, or heart is not filling. Distributive shock is a little different. Like septic shock, it's a little different. There, the blood volume is normal. So